through mast cell degranulation, the 3 causes of bronchoconstriction, and then now we're at the cellular level 3,5 GMP. Any questions? Can I provide clarity? I know some of you are going to have to take it home and read it. I realize that. But right now, does anybody have any questions? Does anybody need any clarity? Yes, sir.
So the beta 2 stimulates the sympathetic nervous system, which raises or elevates the 3,5 GMP.
No, sir.
AMP.
AMP.
Okay, and at that time, the parasympathetic nervous system just kind of takes a back seat or chills out,
It has to.
and then the sympathetic nervous system dilates the bronchial airways, allowing the patient or the asthmatic to breathe normally.
Are you asking me a question? What are you,
No, I'm just summarizing what you went over in the last.
You are correct.
I was good with you until I hit until you hit the 3,5 AMP, and then it kind of got fuzzy, but I think I
Got
got a good grasp.
Right.
Okay, so now when the increase of 3,5 AMP, the 3,5 GMP decreases, and then that's when the bronchodilation happens?
No, this is when the bronchodilation begins. And because it's activation of the sympathetic nervous system, the parasympathetic nervous system, like Kyle said, will take a back seat.
Okay.
This is what bronchodilation is, 3,5 AMP. And that's why we give our drug. Okay, any other questions?
Does that happen because of the drug?
Yes,
Okay,
that's why you
that's
give
what
it.
I want to make sure.
Yeah.
What is the average reaction time on that? So if you've got somebody
It
that's
depends upon the drug. It depends upon the drug. Some are very short acting, some takes longer, and some are long acting. Let's not worry about time right now. Let's just worry about what they do.
right,
Okay, and I didn't mean to cut you off, but don't worry about that right now.
curious.
Any other questions? Everybody with me? Okay, so now I'm going to leave parasympathetic alone for a while, and now we're going to go to sympathetic, okay? You know what the parasympathetic does, nervous system does homeostatically. You know what the parasympathetic nervous system does to an asthmatic and causing mast cell degranulation. You know about serotonin and histamine, right? You know the 3 causes of bronchospasms, right? And you know all asthmatics wheeze, but everybody who wheezes is not asthmatic, all right? And you know when a person is experiencing acute exacerbations of asthma, they have elevated eosinophils. And the doctor will do a blood test, take blood, and see elevated eosinophils, and that will confirm the patient's clinical symptoms, signs and symptoms and manifestations. Not that the physician doesn't believe the patient, but it just confirms even the more what's going on. Make sense? All right. And then you understand at cellular level, increase in 3,5 GMP is parasympathetic nervous system, and for non-asthmatics, that's homeostasis. But for the asthmatic, it increases even the more and causes bronchoconstriction in the airway. Right? Yes. All right, now, here we go. Sympathetic nervous system. Under homeostatic conditions, it lies dormant. I'll leave that up there. Under homeostatic conditions, the sympathetic nervous system lies dormant. However, sometimes it's activated based on what you do. It's called your fight, flight, can you spell? Or what? Fright system. Have you all heard of that in A and P? Okay, that's your sympathetic nervous system. So, sometimes you'll hear of people, maybe in an altercation or whatever, or running or whatever, and they've been shot. And they don't know that they're shot because they're running off of adrenaline and out of excitement, and then they don't realize they're wounded until they see the blood. That's their sympathetic nervous system that's kicked in. Okay? With your sympathetic nervous system, remember the parasympathetic nervous system sustains, maintains, conserves, and reserves energy, right? This stimulates, excites, and utilizes energy. Now this is without medication. This is just our plain old sympathetic nervous system. It stimulates, excites, utilizes energy, whereas the PNS sustains energy. That's why we have a heart rate 60 to 100. That's why we have a sneeze reflex, and a gag reflex, and a cough reflex, and a normal respiratory rate, right? All right. But when this kicks in, it stimulates. So what happens? What happens is you're looking at a scary movie. And I used to do that foolishly still until I started working in a funeral home, and sometimes I was in the funeral home by myself, and I had to stop looking at Night of the Living Dead. I had to stop that. So I don't look at horror movies anymore. No. Because the only one walking around is me. Nobody else. So anyway, if you're looking at a scary movie, or you're going down a dark alley, or you're frightened, right there, when you're frightened, that's stimulation of your sympathetic nervous system. And what happens is, when you have stimulation, it increases your heart rate. Or better yet, gentlemen, you see that diva in that red dress and those 5-inch stilettos, and you say, "Be still, my heart." You thought it was your lust, right? But actually it was your sympathetic nervous system kicking in.
I see trouble, that's when my common sense kicks in.
Yes. Or you see that one, and your heart, okay. Then when you breathe, you notice, watch me, I'm taking a deep breath. What it does, it doesn't increase your respiratory rate. Remember, was it yesterday, we talked about a tidal volume? What it does, it increases the amount of air that you take in during that one breath. So it's called hyperpnea. What does hyper mean? More than.
Excessive.
Pnea means what? Breathing.
Breathing.
Now this is not tachypnea. Tachypnea is when your respiratory rate is greater than 20, right?
Right.
Hyperpnea is just one breath. Maybe your tidal volume is normally 400 milliliters, because we're talking about amount. But then you see that one, and maybe now instead of taking that 400, now you take in 750, because I'm excited you. Whew! Okay? That's stimulation of your sympathetic nervous system. Got it? All right. Any questions? Everybody with me? Okay. So now we're going to, and then also what happens, I got to mention this, because what's the purpose of opening your airways? For here, I'm just going to say broncho relaxation, because it's not true dilation, but your airways kind of open up and relax and chill, and then you can get more in for that breath. Make sense? So your heart will be fast, and your airways will open and relax. Okay. Another example, we did the scary movie. We saw someone, and I'm not being nasty, I'm not being vulgar. This is what actually happens. When you reach a climax, and yes, I'm going there sexually. When you reach a climax, what happens is your body releases hormones. I'll get into those hormones in a minute. And it's for a minute. Your body releases a hormone, and when your body releases the hormone, it's stimulation of the sympathetic nervous system. All right? So right when you reach a climax, your heart pounds. You can actually feel it pound, if that's your thrill. Your heart will pound, and you'll breathe easy. Okay? And all this time you thought it was love, but it was really your sympathetic nervous system kicking in. what happens when you reach a climax. It really does. It's activation of your sympathetic nervous system. And because the sympathetic nervous system excites, it can't be activated all the time. It's just once in a while. That's why most of the time it's dormant. Because you would never slow down. And like I said, we'd be running backwards and barking at the moon if our sympathetic nervous system was activated. We would never sleep. We would never. So most of the conditions, it is not it is not activated. It lies dormant. But conditions where you're fighting or flight or fright, sex, fighting, or actually frightened by a scary movie, it's activated. Okay? And then it stops. And then the parasympathetic then goes back to maintaining homeostasis, right? All right. So now in us, you guys, non-asthmatics, this is good. But in an asthmatic, when mast cell degranulation begins, the sympathetic nervous system alone, it can't cause bronchodilation. It can't do it. It's not enough. So now we as respiratory therapists need to administer a drug that will act like this, particularly this. And so those drugs that we administer and use that acts like this are called bronchodilators or beta-2 agonists. So these drugs are classified as sympathomimetic. That's a very general name. And when I say sympathomimetic, it means it mimics the sympathetic nervous system. So if the sympathetic nervous system does this, we need to administer a drug that will do that. And so remember, an asthmatic has an increase in 3,5-GMP, right?
Yes.
And we need to stop all this. We got to stop it because that's bronchoconstriction, yes? So then we need to administer a drug that will cause an increase in 3,5-AMP. And we know that's what? Bronchodilation. And if this happens, the parasympathetic nervous system does this. Make sense? It's called cause and effect. This is the cause, and this is the effect. Everybody with me? Absorb that. Look at it a little bit. See if it makes sense. 3 increase in 3,5-GMP is bronchoconstriction up there. That's what system?
Parasympathetic.
Right. We give a bronchodilator. And the bronchodilator at cellular level mimics the sympathetic nervous system, and it activates the sympathetic nervous system. So now we have an increase in 3,5-AMP. So if we have an increase in 3,5-AMP, it will cause bronchodilation. And the parasympathetic nervous system, remember, they both can't function at the same time. So if the sympathetic nervous system is increased, the parasympathetic nervous system must lie dormant for now. And consequently, then we'll have bronchodilation. Okay? They can't be equal at the same time.
You said that was cause and effect?
Yeah, look at it, cause and effect. If you
Okay.
increase 3,5-AMP, 3,5-GMP must go down.
Okay, all right.
Okay, it's like a weeble wobble. If one goes one way, the other's got to go the other way. All right? Make sense? All right. Let's come back to the sympathetic nervous system. We talked about this. Oh, I thought you had your hand up. I was going to say yes. Let's talk about the sympathetic nervous system. When you talk about the sympathetic nervous system, in actuality, it's release of hormones. It's release of hormones. Release of hormones. It's release of hormones. And the effect is not long. That's what the sympathetic nervous system, the effect is not long. It'll give you a burst of energy. And again, I'm relating this to practical life. After you reach your orgasm, you're going to do one or two things. You're either going to go to sleep, or you can get up and wash walls. Because you got that burst of energy. So that's what the hormones do. They release a burst of energy, so you got an increase in 3,5-GMP. It excites. Where do these hormones come from? They come from the adrenal glands. And the adrenal glands are superior or sit on top of the kidneys, right? Remember adrenal? Remember that? Okay. And the two hormones are, does anybody remember? No, no. These are adrenal. This is sympathetic. Serotonin and histamine come from mast cell degranulation. Adrenaline. Okay, what is it called? Adrenaline, what's that? That's a drug, and that's the trade name. What's the generic name? You are right. But what is it called? Nobody knows? Epinephrine. Epinephrine. And what's the other one? Norepinephrine. So, whether we're looking at a scary movie, walking down the alley, orgasm, whatever, these hormones are being released from the adrenal gland, and they're going to a target site. They're going somewhere. And when they go somewhere, they're going to have an effect on the organs. Okay? Everybody with me? All right. So, we call drugs, synonymous terms, we call drugs that mimic the sympathetic nervous system, sympathomimetics, right? Mm-hmm. But we can also call them this, and I explain why. Can I erase this here for a minute? We'll come back to it. We can call these drugs, same classification, adrenergic. Adrenergic. Well, why? Because they're acting like the hormones being released from the adrenal glands. So whether you see sympathomimetic or you see adrenergic, that means the drug is mimicking the sympathetic nervous system. That's the word. Turn to, in your pharmacology book, this turn to page 102, 103. I just want you to, chapter 6, 102, 103. I just want you to see the topic. What does it say at the top? 102, 103, 104, 105. What does it say at the top, the very top? Adrenergic. In parentheses it says what? What did I just tell you? Those terms are synonymous. Sympathomimetic means it mimics the sympathetic nervous system. Adrenergic, where did that come from? It's acting like the hormones released from the adrenal glands. So a sympathomimetic and adrenergic drug are synonymous terms, and they are used as drug classifications. So when you do your index cards and you tell me about albuterol and levalbuterol, you can call it three things. You can tell me that it is a sympathomimetic, because it is. You can tell me it's an adrenergic drug, because it is. And then you can also tell me it's a beta-2 agonist drug, because it is. These terms are used synonymous. Okay? Any questions with that? Yes, ma'am.
Do you recommend that we put all three of those on the drug list?
I'm telling you because it depends on the author. You need to know all three.
Okay.
Don't get in your mindset one thing, because you'll have an author that uses another term, and if you don't know what the term means, you'll be lost. So it doesn't matter. So if I want to get technical, I could say, yes, you're correct, it's a sympathomimetic, but what else? And then you could say, well, it's an adrenergic, and I say, yes, you're correct, but what else? And be specific. Then you'll tell me it's a beta-2 agonist. Okay? All right. So, when these hormones are released, let's leave this alone now. When these hormones are released, what happens? Well, epinephrine. When epinephrine is released, it has 3 potential effects. The first is alpha. Beta 1 and beta 2. This is epi. Alpha. Beta 1 and beta 2. Now you can see the differentiation between alpha, beta 1, and beta 2. Alpha is A and beta is B, right? So how do I deal with this beta 1 and beta 2? Here you go. Beta 1, you have 1 heart. So a beta 1 drug affects the heart. Wish I had a red marker.
You need that red marker?
I have one.
You have one? Thank you. So they can. I have some, but they may be in the drawer. Thank you. So, it can be a sympathomimetic drug. It's an adrenergic drug, but it's not a drug for the lungs. It's a drug for the heart. Why? Let's look over here. That's okay, thank you. When the sympathetic nervous system is activated, what does it do? Increases the heart rate. So you got a patient that comes in the ER and their heart rate, better yet, full-blown cardiac arrest. No heart rate at all. The physician is going to order an AMPA-EPI. The epi is going to be a sympathomimetic drug because it's going to act like the sympathetic nervous system. It's going to mimic the function of epinephrine, and it's going to excite, hopefully, excite and stimulate the heart and increase the heart rate from 0 to normal. And if it is a drug for the heart, it's called beta 1. I see your hand. If it's beta 2, you have what? 2 lungs. If it is a beta 2 drug causing bronchodilation, it's for the lungs. Beta 1, 1 heart. So in general, what's an indication for a beta 1 drug? Somebody that comes in with a very, very low heart rate, and you can look at ER or other shows, and the doctor will say an AMPA-EPI. Now you know why, because it is a sympathomimetic drug, it's an adrenergic drug, and its target effect will be, the drug will mimic the sympathetic nervous system and go to the heart and increase the heart rate. So is this indicated for a patient with a heart rate of 160? No. This is indicated for a patient that maybe has a heart rate of 25 or no heart rate. Beta 1 drug. She's like this now.
Beta blockers typically work on the heart, right? And they would block this.
They would have blocked this effect. I haven't gotten there yet.
No, my next question too is, are there any for the lungs for the beta 2? Do they have any blockers?
No, why would you want to block the effect of the lungs?
Well, if something is like overexciting it, is that ever? No.
If it's overexciting, that's bronchoconstriction. No, there's no, we don't, if there was a beta blocker for the lungs, that means all of our airways were shut down. We don't want to block the function of it. Good question, but no. No. Yes.
That was, I had
No,
a question.
no, you don't want that. If we block the function of the airway, we wouldn't breathe. Make sense? All right. So, Beta 1, you have one heart, beta 2, two lungs. Beta 2 causes what specifically? Bronchodilation. Epinephrine is a drug that has the beta 1 effect in it. It has the beta 2 effect. So this drug is wonderful during a full-blown cardiac arrest. Heart's not beating, they're not breathing. Give them epi. Stimulation. Stimulate the heart to raise the heart rate, right? Stimulate the lungs and open them up so they can breathe. And if we have to, we will intubate them and resuscitate. Then alpha. Alpha causes vasoconstriction. Vasoconstriction. Now this doesn't have anything to do with bronchoconstriction. These are blood vessels. What do you think this is for? Yes.
Stroke, maybe?
No, opposite. No.
If you're bleeding out.
Bleeding out, very good. Vasoconstriction or alpha drugs raise your blood pressure. So someone that comes in that's hypotensive, let's say this full-blown cardiac arrest, heart's not beating, no blood is being perfused, and they're not breathing. The doctor orders epi. The beta 1 effect hopefully will increase the heart rate. The beta 2 effect hopefully will open up the airways. And the alpha effect will raise the blood pressure. Now this is the only drug that does all three. We have drugs like albuterol. It only has the beta 2 effect in it. Does that make sense? So as time has gone on, man has perfected and synthetically separated. Who asked me, Bill, was that you that asked me about digoxin?
Yeah.
That's a beta 1 drug. Beta 1 drug. It has no effect on the pulmonary system at all. Beta 1 drug. So you're going to tell me it's sympathomimetic, you're going to tell me it's adrenergic, but you're going to also tell me it's beta 1. Who has vasotec? Alpha. So you know already it's for blood pressure. Okay? All right. So alpha causes vasoconstriction. Now I'm going to throw a little twist, a little wrench in the game. We talked about how many people raised their hands and said they had allergies. Okay, you have allergies. You don't have asthma, but you have allergies. When you come in contact with those antigens, and it makes your nose run, it makes your eyes run, it makes you sneeze, you're miserable, right? Okay. The drug classification, because I discussed histamine, right? The release of histamine during mast cell degranulation, but we understand people that have allergies, they don't actually have mast cell degranulation to the severity that an asthmatic would, right? But they have release of this stuff. The classification of antihistamine is an alpha drug. Because what do? We take the antihistamine, it can be across the counter. We take it, and what it does, we have a plethora of capillaries in our nose for the purpose of warming and humidifying the dry air we breathe in. Everybody with me?
Yeah.
Okay. But what an antihistamine does, it causes vasoconstriction to stop that excess water from running. So antihistamines are sympathomimetics. They're adrenergics, but they only have the alpha effect. Everybody understand that? I'm giving you examples. So there's some drugs out there that only have the alpha effect. There's some drugs out there that only have the beta 1 effect. There are some drugs that you're going to administer is beta 2 only. Doesn't matter. Whatever it's doing, it's still mimicking the sympathetic nervous system. So again, alpha raises the blood pressure or causes vasoconstriction. The beta 1 effect affects the heart. The beta 2 effect causes bronchodilation in the lungs. Got it? And I've given you, not everybody, I've given you all sympathomimetics. Some of you, not everybody, yes.
So when antihistamine, do you have parasympathetic?
It's sympathetic. It's mimicking the sympathetic nervous system. It's mimicking epinephrine. The parasympathetic nervous system does not release hormones. Only this. So this has nothing to do with 3,5-GMP. This has to do with 3,5-AMP. Okay? Any other questions? Okay, so we got alpha, beta 1, and beta 2. You need to know what alpha is. You need to know what beta 1 is. And they're in your book, in your pharmacology book, and they're also in your A&P book as well. Let me see. Go ahead, I'm listening.
Epinephrine has all of these effects, alpha, beta 1, and beta 1 and beta 2.
Right. Turn to page 52. A&P. Is that 52?
Yeah.
Okay, I'm looking at it upside down. Turn to page 52. Table 1, 2. See the heart? Go across. Says sympathetic nervous system. What does it do?
Increases. Right?
Increase the heart. Parasympathetic nervous system. What does it say? Decrease the rate. And in that sense, in parentheses, puts 60 to 100. It maintains the heart rate between 60 and 100. See it?
Yep.
All right. What's next? Bronchial smooth. Go down to bronchial smooth muscle. Look under sympathetic nervous system. Relaxation. In parentheses, put increase 3,5-AMP. So you can correlate this stuff. Got it? Do I need to repeat that? Go down to bronchial smooth muscle. Under the sympathetic nervous system, it says relaxation. You see it? Next to that, in parentheses, put increase 3,5-AMP. Next to relaxation. See it? All right. Come across to the parasympathetic nervous system. What does it do? Causes constriction. Is that in everybody? What kind of patient does it do that to? Put increase in 3,5-GMP next to it. Now your text is giving it to you in a chart form. I explained it in detail up here. Okay, let's go back to the heart. What effect is that? Alpha, beta 1, or beta 2? It is not. It's beta 1.
Beta 1.
Next to the heart, write beta 1. Go down. See bronchial smooth muscle? Where it causes relaxation. What effect is that? Write beta 2 next to it so you can see it. And then you see it has effect on the eyes and intestines and all that, but I'm not going through that, okay? You see where you can compare and contrast right there? All right, let me see what else it has in here. Okay, look under table 1, 2 on the role of neural control in respiratory care. Look at the left-hand side, the bottom paragraph. Everybody with me? It said agents that mimic the sympathetic nervous system are called what? Sympathomimetic drugs. There it is. I didn't make it up. Sympathomimetic agents stimulate the adrenergic beta 2 receptors. When they stimulate beta 2 receptors, you get bronchodilation, and then it's giving you an example of what the drugs may be. Okay. Sympathomimetics that stimulate the heart are called beta 1 drugs. Sympathomimetics or adrenergic drugs that raise the blood pressure are called alpha drugs. Any questions? Can I provide any clarity?
Alpha causes, it works with blood vessels.
Causes them to constrict.
Correct. Beta 1 then
Yes. All right. Now let's go back to that antihistamine. You now know an antihistamine is an alpha drug, right? Vasoconstriction. But if you look, some of you may take drugs your doctor prescribes, which is fine. But next time you go to Rite Aid, CVS, or wherever you go, I want you to just go to the drugs across the counter and find an antihistamine and read the label. The label is going to have a warning. And the warning is going to say, do not take this medication if you have high blood pressure unless first consulting a physician, because it's an alpha drug. And even though we're taking it to stop our nose from running, it's still causing vasoconstriction. And people who have hypertension, if they're not careful and they take too many antihistamines, can stroke right out. Antihistamines raise the blood pressure. That's not why we take them. We want our nose to stop running and our eyes to stop running. But a side effect, it causes increase in blood pressure. So next time you're wherever you are, CVS or wherever, just pick up an antihistamine and read the warning. And sometimes people who have normal blood pressure and don't know, who knows about alpha? Well, it's not a secret, but most lay people don't. They'll take antihistamines too long, and they'll develop high blood pressure because it's still an alpha drug, and all alpha drugs raise the blood pressure. Now, if it's someone who's bleeding out, or if it's someone who's hypertensive, had a blood pressure of 80/40, wonderful, because we wanted to raise blood pressure. So, unless you're taking an antihistamine prescribed by your physician, take warning, it will raise your blood pressure. And your nose will stop running and your eyes will stop running. But you'll be running backwards, barking at the moon, and stroke out and won't know why. Now you've learned. Any questions? Pharmacology is a world all by itself. All right. So we have alpha, beta 1, and beta 2. Beta 2 effect, increase 3,5-AMP. Beta 1 effect, increase 3,5-AMP. Alpha effect, increase 3,5-AMP. All of them at cellular level do that. And that AMP means what? Sympathetic nervous system. It's mimicking the sympathetic nervous system. If it's PNS, it's GMP. Any questions?
Can you go over that just real quick? I got beta 1, and that's where you lost me.
Beta 1, increase 3,5-AMP.
Got that.
Beta 2, increase 3,5-AMP. Alpha, increase 3,5-AMP. Why? Because they all mimic the sympathetic nervous system. Does that make sense? Okay. So let's talk about synonymous terms. Sympathomimetic, adrenergic, beta 2 agonist, and bronchodilator. Can you see how all 4 of those terms put you in the ballpark where you're going? Sympathomimetic, adrenergic, beta 2 agonist, bronchodilator. It doesn't matter which one of those. Sympathomimetic and adrenergic are very general terms. Beta 2 agonist and bronchodilator is specific. You can do that same thing for a cardiac drug. Bill, you have digitalis. It is a sympathomimetic. It is an adrenergic, but it's a beta 1 adrenergic drug. It only affects the heart. It has no effect on blood vessels. It has no effect on the lungs. And so that's how we look at drugs, and that's how we classify them. Okay? Any questions? Okay. So all adrenergic drugs stimulate the activity of the sympathetic nervous system. They stimulate, they excite. They cause the body to use energy. And that's why under homeostatic conditions, the sympathetic nervous system lies dormant. In actuality, when you're healthy, breathing normal, heart rate normal, you only use about 2 to 3% of your body energy. Did you know that? So when you get sick, you begin to use your reserve. And that's why you're listless. And most times for conditions, a lot of conditions, you just have to sleep. You have to rest it off. Because you're utilizing more energy to maintain or to sustain homeostasis. And it takes a lot out of you. Okay. Even when you overeat, think about, nobody does that, but Christmas time, Thanksgiving time, and you overeat. When you overeat, what do you have to do?
Take a nap.
Take a nap. You have to. Because you've overeaten, and that food is going to require more energy from your body to metabolize, so you get tired, and you have to sleep it out. And then you keep doing that, you gain weight. That's what happens. All right. Any questions? Because we're going a little bit further. I don't want to lose anybody. So if you have any questions, I know this is a lot, but this is respiratory care, fundamentals to respiratory care. Everybody with me? All right, so now I guess I don't know if it's in your A&P book, but I just saw that too. I will tell you where to turn. Okay, turn to chapter 5 in your pharmacology book. And the first place I want you to look is on page 79. Under the key point. Page 79 under the key point. It says sympathetic effects. What are sympathetic effects? Alpha, beta 1, and beta 2. Those are the sympathetic effects. Everybody with me? These are it. It says sympathetic effects are widespread, mediated by norepinephrine at nerve endings and by circulating epinephrine released from the adrenal gland. And when it's released from the adrenal gland, that's why we call drugs adrenergic. That's the first point. And so the three effects when we administer a drug that mimics the sympathetic nervous system, it can be all three of these, such as a drug as epinephrine, or it can be drugs that are just alpha, it can be drugs that are just beta 1, or drugs that we use just beta 2. Okay? Man has perfected this to where we can use three drugs that doesn't affect the other organs. That's the first thing I want you to do. All right. Let's turn to page 80. Right at the top, and you got 4 bullets. Let's look at the third bullet. That says sympathomimetic. What does that mean? A drug that mimics the what? The sympathetic nervous system. Right? All right. And then let's look at the first bullet. What does that say? Parasympathomimetic. What does that mean, first of all? A drug that mimics the parasympathetic nervous system. Now, we in respiratory care will not administer parasympathomimetic drugs. We will not administer it, but when you see the term, you know what it means. It's a drug that mimics the parasympathetic nervous system. What is the classification of drug that is taboo, voodoo, forbidden, death-ridden for an asthmatic?
Motion sickness drugs.
What classification drug? Parasympathomimetic. Why? Because a parasympathomimetic will do what? Cause bronchoconstriction. Got it? So an asthmatic will never, ever take a parasympathomimetic. Because when a parasympathomimetic drug is administered, it causes an increase in 3,5-GMP. Right?
Yes.
What does that do to the asthmatic? Bronchoconstriction. It'll kill an asthmatic. So that's a forbidden drug for an asthmatic. That's contraindicated in an asthmatic. Everybody understand that? Got it? I can ask you that on the exam. Which of the following drugs classification is contraindicated in an asthmatic? Parasympathomimetic. And at cellular level, what's happening? Increase in 3,5-GMP. What does that mean? Bronchoconstriction. Everybody got that? All right. Now, let's look at these others. Amy? Good. Okay, I'm learning. Amy asked me about a beta blocker. What's beta? Either the heart or the lungs, right? Okay. So we know a beta 2 is a bronchodilator, and then we could say beta 1 drug stimulates, excites the heart, right? Okay, a beta blocker is a drug that blocks that effect. So let's say we're talking about a beta 1 blocker. If we know the sympathetic nervous system the sympathetic nervous system increases the heart rate. Make sense? Now let's say somebody comes in and they have a heart rate of 180. We don't want to give them a beta 1 drug, right? Because that'll increase their heart rate. That'll kill them, right? So what we'll do is give them a beta blocker, meaning block the effect of the sympathetic nervous system. And if we give them a beta blocker, what is that going to do to their heart rate? Slow it down. So this third term, the last bullet, sympatholytic. Lytic means to stop, to inhibit. And so an example of sympatholytic would be beta blocker. Does that make sense? It's working on the sympathetic nervous system, but it won't allow it to stimulate and get excited. Now somebody's going to ask me, well, do we have a beta blocker for beta 2? No. Because if we block bronchodilation, what would we be causing? Bronchoconstriction. Does that make sense? So generally when we talk about beta blockers, it's those patients that have an elevated heart rate. They have an elevated heart rate. Their heart rate is well above 140, 150, 160. So they have to give them a drug to stop their heart rate, slow it down. And so one kind of drug and one kind of blood pressure drug is called beta blocker. And then as we go further, I'm going to teach you about drugs. There was a question on the registry. I just gave it to the second-year students last week, and boy, did we have a laugh yesterday. It said a patient is in intensive care unit on a beta blocker drug, and the doctor wants the patient to have a bronchodilator. And everybody except 2 people said Alupent. And that was wrong. Because Alupent is a beta 2 drug, right? And then the patient has an excessive heart rate or elevated heart rate. The patient, in this question, it said the patient was on a beta blocker. If we give Alupin, which is a beta-2 drug, to a patient who's on a beta-2 blocker, they are antagonistic, and neither one will work. And they were like, oh, we didn't read. I said, see, they're forever, and I don't know if you all are, they're forever. They want stuff to be the way they want it to be. So they get stuff wrong. They get questions wrong. That's not what it says. So a beta blocker, if a patient is on a beta blocker, then we can't give them a beta-2 drug. Understand that? Because they cancel each other out, and that's called antagonism. I'm fine. I am absolutely fine until I see you coming. And when I see you coming, you irritate me. You get on my nerve and I act ugly. And you see me and I get on your nerve and you act ugly. We are antagonistic. Does that make sense? And together we don't get anything done. That's antagonistic. Opposing factors. We're not in the same book. We're certainly not in the same chapter and definitely not on the same page. So a beta blocker, if a patient is on a beta blocker, and that would be a cardiac drug, we can't administer a beta-2 agonist. We got to figure out what else to do. Yes.
Not a beta-2 blocker, just a beta blocker.
Beta blocker, there is no beta-2 blocker. When we say beta blocker, we're actually referring to beta-1 blocker. We just don't say beta blocker. We just don't say it, rather. It has to be a drug that's slowing down the heart rate. So when you see, you may not know the patient's heart rate, but when you see that a patient is on a beta blocker, you know their problem is an elevated heart rate. Does that make sense to everybody? And they're taking a beta blocker, and what is that beta blocker doing? Decreasing their heart rate. And so another classification for beta blockers would be that fourth bullet, sympatholytic. Sympatho meaning what? The sympathetic nervous system. Lytic meaning slowing down, stopping, inhibiting. Are you okay with me with that term? Because this is pharmacology.
Stopping or inhibiting?
Inhibiting, right. So if a beta-1 agonist increases the heart rate, make sense? A sympatholytic drug or a beta blocker will decrease the heart rate because it's stopping the heart rate from being elevated. Make sense? Does everybody understand that? All right. No, there is no beta-2 blocker. Because if there was beta-2 blocker, it would cause bronchoconstriction, and we don't want that for anybody. Right? So when we refer to beta blocker, it's an inference for beta-1. Make sense? All right. So you got a person that comes in either bradycardic or no heart rate. You want to give them a sympathomimetic. You want to give them a beta-1 drug to do what? Increase the heart rate. Now you got another patient that comes in and they have a heart rate of 180. We certainly don't want to give them a beta-1 drug, do we? We want to give them a sympatholytic to lower their heart rate. Make sense? To inhibit, to stop that rapid heart rate. They're experiencing tachycardia already, so we want to help reverse that heart rate and lower it. Everybody got that? Okay. So sympathomimetic and adrenergic are synonymous terms. Would you agree?
Yes. Yeah. Would you say parasympathetic?
No, I said sympathomimetic
Yes.
and adrenergic are synonymous terms.
Yes.
Would you agree?
Mm-hmm.
Okay. So, sympatholytic. See the lytic?
Mm-hmm.
Now look here, this is adrenergic, right? Now this is anti-adrenergic. These mean the same thing. What does lytic mean? To stop, inhibit. What does anti mean? Stop, inhibit, against. These are synonymous terms. I'm just dealing with the heart. This will increase the heart rate because it's less than 60. Yes? Everybody with me?
Yes.
This will decrease the heart rate because it's greater than 100. This, another name for this would be beta blocker. For the heart. And another name for this would be what? Beta what? Beta 1, one heart. A lot of synonymous terms. Am I talking about the parasympathetic nervous system at all?
No.
Not at all. Am I talking about the lungs?
No.
Not at all. Am I talking about blood pressure? No, not at all. In this case, I'm talking about the heart. Okay? Any questions? Now I'm going to put beta 2 up here. Beta 2, bronchodilator. Bronchodilation, and beta 2 agonist. That's that. Do we want this over here? Absolutely not. This will kill somebody because it will cause bronchoconstriction. So when we're dealing with the lungs, this is all we want. But when you deal with the heart, it depends on what's going on with the heart. So sympathomimetic is adrenergic. It's a beta 2 agonist, so we know it's bronchodilation. When it comes to the lungs, we don't want to use a beta blocker or a sympatholytic or anti-adrenergic, because this would actually make you and I perhaps wheeze. Or you wheeze. You're non-asthmatic, so we don't want this. This will be used for other circumstances like the high heart rate or what have you. Does that make sense? So when it comes to the lungs, the only concern that we have is right here. I gave you a worksheet last week, and now you can take a look at that worksheet. Some of it was definitions, trade name, generic name, but did I give you the worksheet that had increased 3,5 A&P and increased 3,5 G&P? Did I give you that worksheet? Yes. No, that's a handout. Let me see what this is. No, that's your take-home exam. Okay, I probably didn't give it to you because I didn't want to overwhelm you. But I'll give it to you Thursday. You can start working on this. But now let's look at this yellow sheet since you have it out. Okay, over here, I have this on the board. What do these numbers mean? What part of the autonomic nervous system does it represent? Parasympathetic nervous system. And if we administer a drug that's parasympathomimetic, we would use that term, right? Okay. Now, what I didn't tell you about the parasympathetic nervous system, because I told you I had to come back to it. We know the sympathetic nervous system very quickly releases epinephrine and norepinephrine. They're hormones. And that's why the sympathetic nervous system, under homeostatic conditions, lies dormant. Because we don't need hormones to stimulate and excite us and keep our heart rate up. We would be nuts. But the parasympathetic nervous system, it's not a hormone, but it's a chemical released from the brain. Remember I told you the lungs have to be told what to do? Mm-hmm. And it's the medulla oblongata, or the respiratory center, sending instructions to the lungs. Via what nerve? Vagus nerve, which is what number? 10th cranial nerve. Okay. It sends a message. Sends a message. Okay, inhale. Okay, exhale. Okay, normal respiratory rate, 12 to 20, and the lungs are doing. But it sends a message. Who is the messenger? The messenger is acetylcholine. It's a neurotransmitter. It's released directly from the respiratory center, and it goes to the lungs via the 10th cranial nerve, the vagus nerve, and it's called acetyl. It's in your book. Acetylcholine. And we abbreviate it ACH. It's the neurotransmitter that sends messages to the lungs and the bladder or wherever it's going via the 10th cranial nerve. So when you sneeze, your 10th cranial nerve or your respiratory center has released acetylcholine, and it stimulates your sneeze reflex, and you sneeze. The parasympathetic nervous system releases acetylcholine, and it sends messages to your carina, and you cough. Parasympathetic nervous system stimulates your bowels and sends a message via acetylcholine, and you have to have a bowel movement, or you have to urinate, whatever. So the messenger is acetylcholine. Everybody with me? Mm-hmm. So you see the choline here? Mm-hmm. So another name, if we don't want to use parasympathomimetic. When I was younger, I stuttered. So every now and then I'll stutter and keep on moving with my words. I mean, it's just something I got to deal with the rest of my life. I will. So when you hear my R's roll or I don't pronounce something right, it's because when I was younger, I did stutter, but I've overcome. All right. So I don't want to say all that. So what is a synonymous term? Just like that sympathomimetic, I can call it adrenergic. Over here, I can say parasympathomimetic, but I don't want to. So I can call it cholinergic. Well, where did you get that from? All right there. So a synonymous term for parasympathomimetic is cholinergic. And look on page 79. Under the key point to the right on page 79, it says the neurotransmitter, acetylcholine. See it? Mm-hmm. So is that in reference to the parasympathetic or sympathetic nervous system? Okay. So a synonymous term for parasympathomimetic is cholinergic. So cholinergic means acting like acetylcholine. What does acetylcholine do? It sends messages from the brain, from the respiratory center, to the lungs and the heart, and tell them to function. And I'm going through all this because when we get into our drugs, these terms that we're using will be classifications. How do you classify a drug? Most drugs that we use are based off the autonomic nervous system. All the drugs that I gave you, all of them except maybe one or two, furosemide and mannitol, the majority of them are based off the autonomic nervous system. And so in respiratory care, particularly cardiopulmonary, you will not administer all these drugs as a respiratory therapist, but if your patient is on these drugs, you need to be cognizant of what they're doing because it may affect their ventilation, particularly in the critical care area. And you will understand it. Okay? All right. So, parasympathomimetic, or under the autonomic nervous system, parasympathetic nervous system, the neurotransmitter or the messenger is acetylcholine. It is not a hormone. In the sympathetic nervous system, the hormones are norepinephrine and epi. But in the parasympathetic, it's a continual message being released by the respiratory center, and it's going to the heart, and it's going to the lungs, and it's going to your intestines for peristalsis, and it's going to your bladder, and it's going to your eyes, wherever it's going. And the messenger is acetylcholine. And then once that respective organs receives the message from acetylcholine, then it knows what to do. So the lungs, I say, are mechanical. They will not ventilate on their own. So if any patient has, let's say, head injury, and the medulla oblongata is traumatized, or that respiratory center is compromised, they'll never breathe on their own. Never. They'll have to be on mechanical ventilator or long-term mechanical ventilation till they die. Never. Because the lungs cannot function on their own. Okay? Any questions? So everybody that you treat in intensive care unit, their primary problem won't be pulmonary. It can be neurogenic. And if it's neurogenic, then it can compromise the function of the lung. And respiratory therapists understand that. We may not know about the tutor, but we understand heart. We understand lung. We understand neuro in respect to heart and lung. And then we know something about the kidneys because the kidneys and lungs are cousins. And unfortunately, last year, I had some students that just didn't want to grasp it. So they're not second-year students. Because you don't become a second-year student unless you understand this. And I know it's a lot, and we're going to go over it and over it, but I'm saying this so when we get to the respective chapters and we begin to classify the drugs, you know where I'm coming from. It's part of the autonomic nervous system. And is it sympathomimetic or is it parasympathomimetic? What is it doing? Okay? So all drugs that are parasympathomimetic release acetylcholine, and that's the last kind of drug an asthmatic needs. It is contraindicated in an asthmatic. Got it? Do not ever administer it. We wouldn't administer it, but that's why physicians say, do you have asthma? Do you have COPD? Because it's going to make them wheeze and possibly kill them. All right, so acetylcholine, it can be referred to as parasympathomimetic, or it can be referred to as cholinergic. Any questions? All right, so we've gone through back to those terms, parasympathomimetic. Everybody understand that? Back to page 80. Any question with parasympathomimetic? Is that an increase in 3,5-AMP or an increase in 3,5-GMP?
Yeah.
Very good. Okay, the third bullet, sympathomimetic. Is that an increase in 3,5-AMP or increase in 3,5-GMP?
Yeah.
Good. And if the 3,5-AMP is alpha, what is it doing? Vasoconstriction doing what? Raising the blood pressure. If it's increased 3,5-AMP and it's a beta-1 effect, what is it doing? Increasing the heart rate. Okay. And if it's increased 3,5-AMP and it's beta-2 effect, what is it doing? Bronchodilation. You got it. Any questions? Okay. Let's go back to the second bullet. Parasympatholytic. Okay, first of all, is that talking about the parasympathetic nervous system or sympathetic nervous system? Parasympathetic. All right. So if it's lytic, lytic means what? Stop, inhibit, do not pass go, do not collect $200. Monopoly, remember? Okay. Maybe you were all too young. I played Monopoly a whole lot. when I was younger. Okay, so if a drug is parasympatholytic, will it let acetylcholine go or not?
No.
It's going to block the reception of acetylcholine. Stop right here. It's not going to allow it. Okay? And then sympatholytic. First of all, is it parasympathetic or sympathetic? It works on the sympathetic nervous system. And it's lytic, so it means what? Stop or inhibit. Is that in reference to the beta 2 effect? No, because it would cause bronchoconstriction, right? What is it in reference to? Beta 1. So another term for a sympatholytic drug could be what? A beta blocker. And that's in reference to the heart. So if a person is taking a sympatholytic drug or a beta blocker, why? Tell me why.
To increase or decrease?
Which one? To decrease the heart rate. They came in with an elevated heart rate, astronomical, a heart rate of 180. And so the physician will order a beta blocker or a sympatholytic drug to lower that heart rate. Got it? And this is how we classify most of our drugs. Yeah, there's a few antibiotics, and we'll call them antimicrobial. But most of the drugs that we'll deal with, cardiopulmonary, are based off the function of the autonomic nervous system. Is it parasympathetic or is it sympathetic? Yes.
And so if they were already on a parasympathetic drug, would that be a contraindication
For who? What are you
for
talking
the
about?
person getting the beta blocker?
No, those could work synonymously together. They could work together. Yeah, they could work together. But most of the time, I don't want to say in all circumstances, but most of the time, generally they'll start out, if a patient has an elevated heart rate, they'll start out dealing with the sympathetic nervous system. Now you tell me why you think that. You tell me why that's correct. Patients who have an elevated heart rate, the doctor's first choice will probably be a sympatholytic or what we call a beta blocker. Why do you think the doctor would choose to tackle or deal with the sympathetic nervous system as opposed to the parasympathetic nervous system first?
You need to bring the heart rate down.
I'm speaking to her. Yeah, it's going to bring the heart rate down, but why do you think?
Not sure.
Okay? What part of the autonomic nervous system maintains homeostasis in our body at all times?
Sympathetic.
Which part is only flight, fight, or excitement?
Sympathetic.
So the doctor would choose to deal with the sympathetic nervous system because it's supposed to be lying dormant.
Okay.
Leave the parasympathetic nervous system alone because it has responsibilities in maintaining the heart rate and the urine and the bladder and all that. You see? Does it make sense?
Okay.
When you understand physiology, you see why. So if they're going to tackle an elevated heart rate, first choice is deal with the sympathetic nervous system because it shouldn't be overstimulated like this.
It's a warning sign. The red light.
Absolutely. Does that make sense to everybody? All right. Any other questions? Yes.
The
Adrenergic.
I'm not saying that correctly. That was when we talked about the hormones of epinephrine and,
Yeah, or- All your albuterol and all the drugs you're going to learn are adrenergic.
okay, but those are hormones, but what's under the acetylcholine, that is not a hormone, that's
No.
a neurotransmitter.
Right. It's just a neurotransmitter. It's the messenger from the brain to the organ or the target, beta 1,
Okay.
beta 2 alpha. It's it's a messenger to the organ, whether it be the lungs, the heart, the intestines, your bowels, your bladder. It's just a messenger. Okay, you got email. And so acetylcholine will ring your doorbell and say you got email. And you open your email and the message is going to say, parasympathetic nervous system said it's okay to ventilate. And so your lungs will read the email and, okay, I'm going to ventilate. That's how it works. And then it'll go to your bladder and say, you got email. And the bladder say, okay, and then all of a sudden you have to pee. Vagus nerve working. Okay. You're cooking and you shake too much powder, or not powder, too much pepper, and all of a sudden you sneeze. Okay, that's the sympathetic nervous system. That's not the release of a hormone. That's mimicking this. Okay, yes.
So those are only the messengers for the respiratory system.
No, acetylcholine goes to the bladder. Acetylcholine goes to the bowels.
Or the vagus.
Yeah, the vagus nerve goes everywhere. That's why I told you, women that get older, they'll sneeze and pee because it's the same nerve that innervates. I told you about the cardiac patient. The last thing a cardiac patient needs to do is be constipated, because the same vagus nerve that innervates the heart, when they strain for a bowel movement, they'll have a heart attack. And many people have been found on the toilet having a heart attack. I know that from working in a funeral home. They had a heart attack on a toilet because of the vagus nerve. So cardiac patients can't afford to get constipated because the vagus nerve innervates. And it's not a different vagus nerve. It's only 1/10 cranial nerve, the vagus nerve. And it does a lot. The others do too, but ours, we're focusing on cardiopulmonary. Okay? All right. The ninth cranial nerve is what is really responsible for your speech. Okay, wonderful. All right, somebody else had a question? Okay, so we got to go through, again, these synonymous terms. Pull out this this sheet of paper. And you all are going to have to go home and begin to study this. And don't forget, now I haven't forgotten blood gases. I haven't forgotten blood gases. All right. They'll be there. Okay. What does cholinergic mean? What is it in reference to? Parasympathetic or sympathetic?
Very sympathetic.
And it's referring to acetylcholine. Now you got it. And it's going to say the same thing in your pharmacology book too. Okay.
So that cholinergic or
PNS. Okay, what is anticholinergic?
PNS.
It's PNS as well. But it's against it. Okay? So let's look at this. I'll show you this. Some drugs, the majority of drugs that we're used, see if you can figure this out. See if you've been listening to me. The majority of drugs that we use will do this. And so what system, nervous system particularly, are they mimicking or functioning like? Sympathetic nervous system, right? Very good. And consequently, in reference to the lungs, what is that going to cause? Bronchodilation. Very good. But there are some patients, maybe they've had asthma for a long time, and I'll talk about that next semester, static as asthmatics. Maybe they've had asthma for a long time, or maybe they're COPD, and they're just not responding to this. You get a little relief, but not getting maximum relief. So then we can give them a drug that does this. And don't get caught up in that. What is this G? Parasympathetic nervous system. And now I got it decreases it, right? So would it be parasympatholytic or would it be parasympatholytic? Parasympatholytic. And so very good. You all are learning something. Woo! I'm happy for you. So parasympatholytic. Patholytic, Kathy. Okay. And what? Cholinergic mean the same thing. Would you agree with me? And I'm not trying to pull your leg.
Yes.
Yes?
I would.
You agree?
Yeah.
Would you agree that either one of these, they're synonymous, does this?
Yeah.
Everybody say yes.
Yes.
Okay, good. Okay, what happens is, after a period of time, some asthmatics and maybe COPD patients, they don't respond so well to this. And they need another drug to go with this. We never stop giving them this. But they need another drug. So then what the doctor would do, just like the question you asked, what do we deal with first? Well, what we deal with first is the sympathetic nervous system. Why? Because it's overactivated and it should be lying dormant. But after we dealt with the sympathetic nervous system as long as we could, and now it's not responding, okay, then we got to go to the big fella, the parasympathetic nervous system. But when you have a drug that blocks the effect of the parasympathetic nervous system, what could it do?
Could affect other aspects of homeostasis.
It could, but let's talk about the asthmatic. You're absolutely right, and I'm not going to dispute that. But I'm speaking pathophysiologically about an asthmatic patient.
Could it also affect their breathing and their breathing rate? I mean, the pair is controlling all that, so.
You got an asthmatic who's having an acute asthma attack.
Well, it's not so hypersensitive now because you're bringing that down. Because if their parasympathetic nervous system is hypersensitive, and you give them an
Cholinergic.
cholinergic, it should bring that down, should it not? But would it also?
It does, but I'm asking you, what does it do? I'm asking you, what does it do? You're saying bringing it down. I'm asking, what do you think it would do? What will it bring down? Huh?
I'm sorry, bronchodilation.
It will stop bronchoconstriction.
But not dilate.
Increase 3,5 AMP. I'm sorry, increase in 3,5 GMP causes what? Let's look at it.
Constriction.
Constriction. Increase 3,5 GMP causes bronchoconstriction, right?
And this is the anticolon or
No, this asthma. This is this asthma.
the, okay?
Okay. Now, we've been given this drug, let's say, for umpteen years. And for umpteen years it's been effective. But this is one sunny day, October what, 8th? What's today's date?
8.
And it ain't working. And we know it ain't working. So what are we going to do? Well, we don't stop giving them this drug, but we got to give them something else. So what we're going to do is give them a parasympatholytic. And so if we decrease 3,5 GMP, that may not completely stop the bronchoconstriction, but it'll help it. The only way you get bronchodilation is through what? This is bronchodilation. And this is called front door. It's called front door bronchodilator. This is called back door. This drug by itself may not necessarily work, but it's called back door. So what do? You learned a term last week, synergy or synergism. What does synergism mean? Two drugs working together. This is still going to be the dominant drug, but this is going to be a synergistic drug that we give. So let's look at this. If we have a decrease in 3,5 GMP, then therefore we can have an increase in 3,5 AMP effect longer. The longer we have this effect, what do we have? The longer we have this, bronchodilation. So we're giving two drugs, not everybody, because if this works, this is all we're going to give them. But over a period of time, if this by itself doesn't work, we will give them an anticholinergic drug or a parasympatholytic drug. And look on your sheet. Look on this sheet. Pull this sheet out. Everybody see it? Look to the far right. It says ipratropium bromide. Look under there, Combivent. It's called Respimat. What is the albuterol sulfate? What kind of drug is that? A bronchodilator doing this. Now, look above it, the same drug, Combivent or Respimat. There's ipratropium bromide. That is called a parasympatholytic or anticholinergic drug. It's doing this. And so it's in one medication, 2 drugs in one medication. So you got 2 different classifications of drugs in this Combivent. You got a parasympatholytic or an anticholinergic drug. And then you got what? A beta-2 agonist. And together, they cause bronchodilation. Why? Because the patient no longer is responding to the sympathomimetic drug alone. They need something else now. So what are we going to do? We're going to give them anticholinergic. Will an anticholinergic drug by itself stop bronchodilation? No. Because it's just holding back the parasympathetic nervous system. How do we get bronchodilation? Through the sympathetic nervous system. Does that make sense? So these 2 drugs are working together. But we don't start everybody off with these 2 drugs. This is for someone that's been struggling for a long time, and they've developed a tolerance. We use that term. They've developed a tolerance, and they just won't respond to conventional bronchodilator therapy. So we give them 2 drugs together. In their classifications, the increase in 3,5-AMP would be the albuterol, the beta-2 agonist, and then the ipratropium bromide. You can, I don't know what chapter it is, but you can look in your pharmacology book and see that it is anticholinergic or parasympatholytic, and they had put them in the same combination of drugs, and so they're synergistic drugs. So let me ask you this. Would an anticholinergic drug be your first choice to give to someone wheezing? Because it's backdoor. It has to be administered with a beta-2 agonist. Beta-2 agonist is true. Okay? Anticholinergic is partially true. It may not work by itself, but a beta-2 will. Okay? So if I see somebody on Combivent or Respimat, I know they've been struggling for a while. And when we talk about blood gases, that's a chronic condition. That's chronic. Maybe they've been struggling and they've had this condition, maybe because they won't stop smoking. I'm taking it to the extreme. And now it's 10 years out. Well, they're just not going to respond to albuterol. They need something else. So we're going to give them a combination of both drugs. Attack it from the front door, increase 3,5-AMP, but also attempt to hold back 3,5-GMP. So this is not a true bronchodilator, but it can be given synergistically with a bronchodilator. And so this drug over here, ipratropium bromide, is an example of a synergistic anticholinergic and a sympathomimetic or beta-2 agonist given together. Okay, I'm going to stop right there because I'm not going any further. I know you have a lot to absorb, but are there any questions? What I want you to do is I want you to take this yellow sheet and go through and see if, I didn't get through everything, but see if you can begin to identify these terms. Use your pharmacology book, and I'm going to tell you what to use, just for the terms, not for the content. Okay, chapter 5 is central and peripheral nervous system. If you need to review, autonomic nervous system, parasympathetic, sympathetic, acetylcholine. It's in chapter 5. Look at page 80, key point. First key point. Parasympathomimetic. What's another name? Cholinergic. Where does that cholinergic come from? Neurotransmitter, acetylcholine. See the association? All right. Parasympatholytic, anticholinergic, blocks, inhibits the release of acetylcholine. Make sense? All right. Then sympathomimetic, synonymous term, adrenergic. Why? Because the adrenal glands secrete the hormones. Sympatholytic, anti-adrenergic. And I gave you another name for that one. What did I give you? Sympatholytic, anti-adrenergic. What's another name? Beta what? Beta what?
Beta blocker.
Beta blocker.
Blocker.
Write it down in your book. The more you see it, the more you understand it. So under sympatholytic, anti-adrenergic, and the key point, you can call it a beta blocker. Does that make sense to you? Okay, so here's chapter 5. If you want to know more, you can wait on me. But if you want to see the adrenergic bronchodilators, turn to chapter 6. There they are. That's the sympathomimetics. It's chapter 6. Turn to page 98. 98. See the epinephrine that I was talking about? See it? All right, there it is. And then 2 drugs that I gave you today were albuterol and levalbuterol. See them right there?
Yes.
I don't make this stuff up. It's in the book. Okay? Chapter 7. If you just want to see where I got the terms from. Anticholinergic, parasympatholytic. They're bronchodilators. But are they front door bronchodilators? No, they're back door. The true bronchodilator is a beta-2 agonist, right? This is a drug that can be administered synergistically with a beta-2 agonist. And I just gave you an example, Combivent and Respimat. See these terms? All right. So you can look, I'm not asking you to go ahead and read the chapters. If you want to, you can. I'm just talking about the word association. And start checking out the words on here. If you see something and it says it's cholinergic, you should be able to tell me what cholinergic means. Cholinergic is in reference to the parasympathetic nervous system, and I understand acetylcholine is the neurotransmitter. I know acetylcholine is bad for the asthmatic, and I know that it causes bronchoconstriction. Make sense? Start studying it. So you want to know what to do. Now I'm going to give you an assignment for your workbook. You all have been waiting on it. Chapter 1. Page 1. Do page 2. Page 3. Do all of page 1, 2, and 3. On page 4, turn to page 4. You do not need to do 29 and 30, but I want you to do under the prescription, name the 6 parts of a prescription. I want you to do that, number 31. And number 32 is kind of self-explanatory. Do you all need to do that? Number 32. You can give an example over-counter drug. I'm not going to ask you the name of an over-counter drug, but you can do that. And number 33 is true or false. Okay, let's look at page 5. You've learned one of your student learning outcomes, but we haven't got to it. It talks about the 7 classifications of respiratory care pharmacology. There they are. You've learned the first 2 today. In this table, you've learned adrenergic, and you've learned anticholinergic today. Would you agree?
Yes.
So we have more to learn. These are different classifications: mucoactive, corticosteroid, anti-asthmatic, anti-infective, and surfactant. We haven't gotten to those yet, but you can do page 35. I want you to do the adrenergic and the anti-cholinergic. I'm sorry, page 5, number 35. Everybody got that? And I'm going to keep referring back to page 5. As we go through these drug classifications, you can go back to page 5 and complete this chart. Because we've got to get through 7 classifications of drugs. The 2 heaviest we went through today, adrenergic and anticholinergic. So when we start talking about drugs and it says that it's an anticholinergic drug, you understand what that means. And the drugs that I gave you today, albuterol and levobuterol, are both adrenergic. They are both beta-2 drugs. Yes? Okay. And then the medical terminology, still on page 5, do the medical terminology. And that's all I want you to do in the workbook for now. We'll get to the rest. Okay? Still not satisfied? One more? Because I can give you an assignment in chapter 5. I can give you workbook chapter 5, bronchodilators. We can start on it.
That helps me learn that I want it.
All right. Let's turn to chapter 5.
Guess you want it too.
No, I don't.
No, God, thank you.
All right, turn to page 59, 58. On page 58, number 13, number 14, 15, 16, 17, 18. Number 19, parasympathetic nervous system and sympathetic nervous system. All right, and then number 26. 26 has got 1 through 8. Match. Here you go. Page 59. Got it?
Yes.
Any questions? That will reinforce what we covered today. Page 58 and 59, chapter 5. Just do it. Just do it. All right. Any other questions? Yes. So if I asked you to give me an example of an anticholinergic drug, what are you going to tell me? Give me an example. You don't need it anymore. You haven't learned what you're supposed to.